Good morning. And I actually wanted to start with picking up on Malcolm, your comments of thanks to the Global Forum for putting this question on the table. I wanted to start with a gratitude to the panel, to the consensus panel for taking on this from my perspective, and I think from the conversations we've had as part of the Global Forum, a very complex task. So I empathize with Patricia trying to focus that statement of task. It is very complex. And as we've been thinking about this particular topic, I wanted to just share some of the complexities that have been on the table. And of course, no surprise, the first one is a definitional issue around complexity. And so how, as the consensus panel goes forward, will you grapple with the definitions of interprofessional education and collaborative practice? Because while we have some standard definitions, particularly from the World Health Organization, we know from a lot of the current literature that how IPE and collaborative practice have been defined is quite variable. And so how will you grapple with that level of complexity? The second issue we've talked about, which is also a definitional issue, but beyond that, is what is the definition of impact? And how can we think about the different voices, the different stakeholders that would have a perspective on what impact would mean for them? So how would patients and families define impact? How would learners across the continuum of learning, across the lifespan of learning, define impact? How might our policymakers, economists, and healthcare leaders define impact? And so that there is a level of complexity just in that very simple 6-letter word. One of the things that I like to think about in terms of the complexity of this issue is a question of linearity. And you heard Malcolm talk about there are very few educational interventions that have laid themselves on the table for scrutiny. And sometimes when I hear, certainly in my own environment, the question of what's been the return on investment in IPE, I think people are looking sometimes for the easy answer. How does IPE lead to collaborative practice? And we know that it's not a linear relationship. We are without a conceptual framework at this time that really helps us to understand the theory of impact. So first we need to have that definition of what does impact mean. But the consensus panel will also need to think about, in the absence of a theory of impact, how do we approach the evidence? So 4 suggestions, some of which actually came out of the discussion yesterday of the planning group of the global, or planning meeting of the Global Forum. And one that came to mind as we were coming back and forth to the notion of competency frameworks, is there a way to break down IPE and collaborative practice by actually looking at some of the competency frameworks, particularly the IPEC competency framework? But we know we have the Canadian Interprofessional Health Collaboratives Competency Framework and Australia's Capability Framework. And that might give the consensus panel a way to break down the notions of IPE and collaborative practice, to think about what's the evidence around interprofessional communication, interprofessional conflict, collaborative leadership, for example. So perhaps looking at competency frameworks as a way to deal with the complexity might be helpful to the consensus panel. The second one, and this was a conversation we had at the end of yesterday around how does the Global Forum continue to bring in the global perspective and the global community in its work. And as the consensus panel particularly thinks about methods of measuring impact going forward beyond the evidence that's available today, to really think about the global context and the kinds of methods that will be generalizable, applicable to different parts of the world. The third consideration is really how do we think about the emerging evidence? And I do believe that we are at the cusp of a tsunami of evidence that isn't necessarily right at our fingertips. There has been a tremendous amount of experimentation in this field in the US and abroad for the last, I would say, 3 to 5 years. That's probably at the tip of being published. That's at the tip of going full scale. And so how will the consensus panel find, access, this tsunami of emerging evidence that isn't quite visible to us in the moment? And lastly, to really think about the target of the recommendations. And while this is a global forum focused on innovations in health professional education, I think we would be remiss if we didn't think about how the recommendations of this consensus panel need to be targeted to and need to be taken up by healthcare leaders, health system leaders, and policymakers. So while our focus certainly is on education, I suspect what we will hear from the evidence base is that there needs to be fundamental shifts and transformations in practice, in care, and in policy, and for us to think about how we target those sectors as well. So thank you for the opportunity to share some comments, and good luck.